All right, so you guys heard the announcement that the meeting's being recorded. So I just want everybody to know that. So be cautious if you say anything crazy or whatever. Good morning. This is the episode quality improvement regular meeting, and I will tell you that first of all, I want to thank the state staff who didn't back out and cancel this when the governor announced today was a state holiday. So please. Give Tequila and Maddy and the other state employees who are on the call doing all the work an extra special thank you, because they're doing it on what should be a vacation day for them. So thank you guys. Secondly, we do have a relatively short meeting planned for this morning, so we're hoping to give you a little bit of time back. We're going to give you some updates on where we are and what's going on. One other logistical issue is it looks like, given the way enrollment is going to fall and the way schedule is going to fall, we're not going to need the August equip meeting. We will have the July equip meeting, and that will be an important one. Another logistical issue is, and Jessica will talk about this a little later in the meeting, we are going to do some special meetings with CRISP to go through EEP and how to use the portal. And I just mentioned this now, again, we'll talk about it again later. I do think for those of you who are interested in enrolling this year, you're going to want to go to one of those presentations. I think it'd be very helpful. So I think that concludes my introductory comments for the start of this. And I'm going to go ahead and turn it over to, I guess, Tequila.
Yep. I just want to say good morning and welcome to everyone. We are delighted to be here today with all of you to talk about EQUIP. To Jean's point, we have a sort of an abbreviated set of content for today's meeting. Our goal is simply to highlight, again, where we are in the process, and then talk about, again, the timeline, specifically what's coming up over the next few weeks that we want to make sure people are aware of. And then we'll review sort of the plan for the next couple of months for this meeting. We will have a July meeting. We are planning to cancel the August meeting, though. So the July meeting will be pretty important to participate in, especially for those of you who are considering enrolling in this program, because that is where we will have the official sort of conversation around enrollment and what that episode portal looks like. So again, thank you for being here today. I'm going to turn it over to my colleague, Maddy Jackson, and then Jessica Heaslop to walk us through today's content. So Maddy, you may be on mute. Don't hear yet.
Sorry. Trying to get the thing to pop up. Hi, everyone. So as Tequila mentioned, just a couple housekeeping updates. I also want to walk through the timeline and where we're going to look for the next couple of months. And then we also wanted to allow this opportunity for some, Q&A if there are late-breaking questions as you guys are discussing this as organizations, that sort of thing. We wanted to make ourselves available today as well. So as Tequila mentioned, as Jean mentioned, our enrollment opens on July 9th. What this means is the EQUIP entity portal will be available for you to start inputting your organization's NPIs and physician info, payment remission source, all of the key components to enrollment in the program into CRISP, July 9th. That will only be open from July 9th to September 1st, where it will close for CMS vetting, and we'll talk through how that process works in a second. Additionally, I do want to mention, and I think we've brought it up a couple times before, but our staff is available for one-on-one demos and meetings with your organizations to talk about EQUIP. We can answer any specific questions. We can walk through episode definitions. Additionally, what we're offering is opportunity analysis. So if you have a list of potential physicians and potential NPIs that you're thinking about putting into an EQUIP entity, go ahead and send those over. We can give you kind of a back of the envelope estimate of what your 2019 baseline looks like from right now. And so I think, this is a great opportunity to kind of, really drill into the specifics for your organization. And our staff is very happy and excited to be able to hold these meetings with, the few people who have asked thus far and future. And And again, this is available before July 9th, so it's a good opportunity to kind of, start kicking the tires on participation ahead of the EEP opening. If you have any questions, again, we just wanted to put up our contact, which is equip@crisphealth.org. They're a very good navigator. They'll get you to where you need to go, whether it's a policy question, whether it's a CRISP question, all sorts of things. Go ahead and send that there, and it's a good source. As Jean and Tequila mentioned, our next meeting will be on July 16th. So if you would like to be added to that distribution list, please email Barbara at MedChi. And then we are going to cancel the August 20th meeting. Again, that doesn't mean that our staff won't be available for one-on-one meetings, kind of questions, answers, all that throughout July and August. And then finally, I did want to also note our website is up to date with all of these past webinars. We've also put up a kind of interesting little 2-pager that is easy enough to send around an organization. It really hits the high points of EQIP. We've also put together a 101 slide deck that is now available on the website. So you can go and download some of the base slides that I'm sure many of you have seen in this work group before, but really have that resource to click through, put the pen to paper and pass around your organizations. So moving on, I did want to walk through the timeline again. As I mentioned, throughout the rest of this month, we are going to be doing recruitment, opportunity analysis, one-on-one meetings, and information sessions with organizations should they request it. Additionally, right now, what you can be doing as an organization is ensuring that you are credentialed into the CRISP CRS system, so that way you can be ready for EEP enrollment when it opens on July 9th. Looking at this blue box, July 9th is really the go live date where we're going to open EEP for enrollment. Additionally, on July 9th, we will release the technical policy and portal user guides. So there will be 2 user guides, one to help you navigate EEP, the second to kind of give you all of the detail into the technical policy and calculations that go into setting target prices, determining incentive payments, determining participation parameters, all that fun stuff. And then also on that July 9th date, you will be able to see your baseline episode experience in EEP, though again, we are happy to do opportunity analysis for your organization ahead of them.
And Maddy, let me just jump in for a second, because we have been using the acronym EEP, throughout the conversation thus far. Can you just remind everyone what EEP stands for and what it is?
Yes, thank you, Tequila. So EEP again is that EQIP entity portal in CRISP. That's where all of the enrollment and program management will occur, as well as any data for the program will be pushed back out. So we lovingly call it EEP. We think it's a very fun acronym that we pulled together there, but it's the EQIP entity portal. Essentially, we're referring to CRISP there when we talk about EEP. Thanks, Tequila. On September 1st, this is the deadline for all of your NPIs, or the National Provider Identification Numbers, and other enrollment initiation information to be submitted into EEP. This is not the deadline for contracting. It is also not the deadline to finalize your episode selections. This is just when we need to know the final listing of physicians that will be included in your EQIP entity. The reason for this, again, is that we will then submit these providers to CMS for vetting and program integrity checks to ensure that they can be participants in the program. We anticipate to get that vetting information back no later than December 1st, at which point we will start to finalize our care partner arrangements, ensure that payment operations are put into place with the CRP entity, and kind of tie up any loose ends for participation, including finalizing those episode selections for year 1. On January 1st, we start the program, which means really just performance starts. So the care partner participation opportunity will be annual. So if you are not vetted and finalized by that kind of December timeframe, your next opportunity for participation will not be until January of 2023. And then we will also put into EEP the preliminary target prices. Again, a note about these target prices is that they have to be inflated through 2022 to really be comparable to 2022 performance costs. So we do really want to strongly caveat here that these are the preliminary target prices, and they will be updated as we get inflation throughout the year. In March of 2022, we will have some performance analytics start to roll in through EEP or CRISP. And what this will include is, claims run, completed claims, but also, a start to look at some episodes. There are only a few episodes that are, I think, short enough to make it into this first batch, but as episodes become more available throughout the year, they will roll into EEP or CRISP monthly. And then July 1st of 2022 is when Performance Year 2 enrollment opens. So again, if you're not in that first group for Performance Year 1, we will open enrollment and hopefully look at adding new episode opportunities based off of our stakeholder feedback and discussions with this group. But that happens all July of next year. And then July 1st of 2023 is when your organization will receive that lump sum incentive payment. So just a quick overview. I think, again, this is a good resource to keep referring back to, but I want to make sure there aren't any late breaking questions or items in the chat, which I can't see. Jean, if you can mention those.
So there is one question that came through, Maddy, that looks like the question is, can you address updating NPI lists over time? And that came from Adam. So if you can talk about sort of our thinking around that, I think that would be helpful.
Sure. So updating the NPI lists goes along with this care partner participation opportunity. So we really are hoping that people put in, make sure that the NPI lists are tight and correct when they go into the portal in that July to September timeframe. After that September 1st timeframe, there will be very little, if at all, opportunity to update NPI lists. And I think the only thing we would look towards is really name corrections, little things there, but we really need to make sure that the data inputted from July to September is as accurate as possible. If you would like to add NPIs to your EQIP entity, so you have participation in Performance Year 1, there are people who would like to participate in the next performance year, that opportunity opens July of next year. So July of 2022, we will again have the same process where EEP will open up enrollment. And so you will be able to add, remove, append different NPIs to your EQIP entity's participation. So there are edit opportunities, though limited and in those kind of time frame, those truncated time periods. Okay, so we can keep going if there are other questions, or again, we'll have some Q&A time at the end if people, if things come to mind after this. And then we also just wanted to reiterate participation requirements. So that way, again, when EEP opens, everyone is prepared and ready to go. The first bucket that we think about participation in is that you have to qualify with a care partner with CMS. This means that you have to be licensed and enrolled in the Medicare provider enrollment chain and PCOS system. This is a really, really important piece. This is what determines your CMS vetting. If you are not up to date in that system or in PCOS, if you have had changes since you first enrolled in PCOS, this will come back and kind of snag your vetting. So there are some really great resources on the PCOS website, including a checklist of things to ensure have not changed since your initial enrollment. And if they have changed, it's very simple to go and update it with CMS. We're happy to pass that around. We'll also place that on our website so that way everyone has a common resource to kind of make sure that they're up to date in PCOS so they're ready to go on July 9th. Additionally, care partners in EQIP will need to use CERT and CRISP, or Health Information Exchange. So that means that you're using an EHR and connected to CRISP. That's a parameter for participation in an advanced alternative payment model. The second bucket is that you actually have to enroll in EQIP, which is the July 9th opening date. So you will have to determine how you would like to establish your EQIP entity with multiple care partners or physicians. I will mention you are eligible to create an EQIP entity with a singular care partner, and that's something that you can explore when the EEP portal or when EEP opens. Additionally, enrollment in EQIP requires episode selection and interventions, and then that you also agree to our quality metrics. So if your EQIP entity, Every physician in your EQIP entity will have the same episodes and interventions selected. There will not be difference based off of providers included in the EQIP entity. It's an aggregate reconciliation and aggregate performance assessment. And then each care partner, as we've mentioned, will need to sign a care partner arrangement. So this means every individual NPI, every individual physician will need to sign a care partner arrangement indicating that they are participating in the EQIP entity and that their payment will be sent to that EQIP entity for their performance. And then the last piece again is that you must determine where your payment remission recipient is. This will be one singular spot for each EQIP entity. Again, it's a lump sum across all care partners who participate that will be paid out July of 2023. The last piece is that we have episode thresholds that you need to meet in EQIP. So the first is that this care must be provided in Maryland to Maryland Medicare beneficiaries. That is what will be included in your episode count. I think we have some physicians that might practice partially in Maryland, partially in DC. It will only be on your Maryland fee-for-service Medicare beneficiaries. The second piece is that for a single episode across the EQIP entity, there must be at least 11 episodes in the baseline. So that means for all the NPIs that are included in, say, hip replacement, you need to meet at least 11 in the 2019 baseline in terms of a volume. And again, this is something that we can show you in your opportunity analysis if you have questions around that now. And then across all of your episodes of participation, we need to see at least 50 episodes in the baseline. So there needs to be, if you have 3 singular episodes together, they all need to be above 11. And then in total, they need to be above 50 for your EQIP entity to be viable. So again, this episode threshold piece will be available in EEP on July 9th. However, if you have questions now, please feel free to email and we can go ahead and pull your NPIs and look at what the baseline experience looks now. Okay, so before we do a quick update on EEP with Jessica, I wanted to just open it up for questions, see if there are any items that you need clarity on, offer this time this morning on our shortened.
Hey, Maddy, this is Jim Trumbull. Just real quick on that last slide. I know me and Cindy have emailed you a few times trying to understand this, and honestly, I'm still not entirely clear. So if there was 3 episodes that a group of physician specialists signed up for, they'd have to meet 11 across all of them for each episode. And so, which is only 33 if there was 3 of them. But because of that's the 3 episodes they can be in, they still have to meet the 50 requirement as well.
Yes, that is correct.
Okay.
So there's an 11 minimum on each episode, and then if they didn't meet the 50 threshold, they would have to either add an episode or wouldn't be eligible with that grouping of physicians.
So if they only did 1 of the 3, they still have to meet the 50 for the 1?
Yes.
Wow. Okay.
But again, it's in the aggregate across your EQIP entity, so it can be the collection of physicians, however large or small they would like to participate. Gotcha.
All right, thank you.
So building on that question, let's say that Dr. Trimble gets the PRMC docs to sign up. So if the GI doc and the cardiologist they have, for example, do it, you can cross specialty in the EQIP entity to hit the 50 threshold, can't you?
Yes, you can combine any assortment of specialties in your EQIP entity.
So just, for those of you who are with bigger entities and you're going to have a bigger EQIP entity or you have a bigger TIN, the 50 thing probably is not that big a deal. And you might even be able to get some doctors who are doing less units, less numbers in your entity because the others are going to carry the weight for them. Do you know what I'm saying? Maybe I'm not articulating it as well as I should, but anyway.
No, I think that clarifies it, Gene, because I misunderstood. I thought the EQIP entity was going to be each practice, which made it difficult for like solo practices.
Right.
But the fact that it's, the entity exists within our Peninsula regional group, so to speak, that makes it a lot easier to meet that requirement.
Well,
thank you.
It could be hard for solo practice, though. That is a problem that we're worried about because if you're a solo cardiologist and you do 50 procedures a year, you might have real trouble hitting the numbers. So I don't know. I guess they could maybe work with us to try to figure out how to create EQUIP entity. I don't know how we would do that, but I think it's actually ironically easier for a larger private group or a hospital group to do this than it is for the little guy. I mean,
Yeah.
the same shot, it's just hard, they just have trouble with threshold. Anyway, yeah, that is an issue, but it's not like the Maryland Primary Care Program where each individual doctor has to hit their individual threshold of the 125 in the Maryland Primary Care Program. And we did all run into that, for those of us who are dealing with that, where we lose a doctor here and there because he just didn't have enough Medicare patients. Anyway.
I'll also add that the only parameters around an EQUIP entity are your definition and designation of the NPIs, right? So it can be at a practice level, it can be 2 practices together. It doesn't have to be across the whole organization. We wanted the definition to be flexible to kind of address, some of the concerns about the smaller physicians, to Jean's point, but then also, make sure that this works for each system and how they would like to administer the program.
If we end up having a handful of smaller doctors who are having trouble hitting the numbers, maybe that's something that MedChi and HSCRC can work together to try to help create maybe an entity for those people or do something to figure it out. If we run into that, we're doing, and I think Maddy and Tequila both mentioned this earlier, we've been doing these calls with different groups, and some are very small. It's a complete mix of who we're talking to do opportunity analysis and discuss with it. So if we run into that, or if you know people who are concerned about that, please send them to us, because we want this to be available to everybody, not just big practices.
Yes, absolutely. And, Jean, we can talk about that further. I think, the opportunity analysis, send me the NPIs. It's very quick. We can do a quick search, show you what you're showing, in our system right now. So that way, as you're kind of having these conversations over the next couple of weeks, you can figure out, how to cut and paste different practices, different participation together. And there are some physicians that do qualify individually on their own with the thresholds singular episode. So I want to caveat that if you're doing a bunch of colonoscopies, chances are you're going to hit above that 50 mark in your Medicare space. So, some people could run into that problem, some could sail past it. So it's just something that we need to individually address with each participant. But thank you, Jim. That's a very helpful question. I think helpful to keep clarifying. Are there any other questions, or we can go ahead and move on to some updates on EEP and then let everyone go enjoy our new national holidays. Okay, Jessica, I will turn it over to you.
Good morning, everyone. Thanks, Maddy. So as hopefully we've kind of hammered into everyone, EEP is our EQUIP entity portal, which is essentially it's a portal that lives within the CRISP reporting services, and it is this one-stop shop. At times we like to compare it to like your TurboTax of EQUIP. So it's your one-stop shop that really people will be able to enroll into, be able to get feedback about their status as far as both vetting and the execution of their care partner arrangement. And then ultimately, it is also the portal in which the performance analytics data will live, obviously, once the year kicks off. So as Maddy mentioned, there definitely are minimum requirements to get into to be eligible for the program. This EEP portal will be able to actually show that level of eligibility and have either that lead care partner or administrative proxy be able to select and update those episodes and interventions that they are choosing to participate in for performance year 1, really up until the start of that January 1st go live date. Do next page, Maddy. So, so the biggest thing, as Maddy mentioned, that can be done now is really checking in on sort of the credentialing status within the CRISP system. Many organizations actually have already reached out to our equip@crisphealth.org mailbox, which we greatly appreciate. And we found that many people already have an active participation agreement with CRISP. And it's just a matter of noting down who that lead care partner is, so that when the portal does go live, that lead care partner will be granted access to the EEP portal. It's just a reminder that the initiation in the portal must be done by that lead care partner. Once they're in the system, there are a couple steps that will be required, and then they can delegate an administrative proxy to finish out the rest of the enrollment process. But that first initial step, because this is a physician-led program and we really want to ensure that it's being kicked off from a provider, that has to be done by a lead care provider. If you have any questions about the status of your participation agreement with CRISP, again, please email that equip@crisphealth.org. We will let you know. For those that do not have a participation agreement, there are a couple of forms and steps that we will send back to you that needs to be completed so you get access to the system. As mentioned, the process for getting that lead care partner into the system is simply just, if you have a participation agreement, is simply just contacting the point of contact for your group, and we will get you access once that goes live. Just as a note, the enrollment part of the portal is a non-PHI software. So you'll be able to see information, any cell size with numbers less than 11 will be hidden. But what that means is that at this time, individuals do not need to go through the end user agreement process. However, once we develop and roll out the performance information, and that will allow PHI information to be seen for those organizations to do a deeper dive on their opportunities. At that point, we would require a photo ID and end user agreement for the users that will be accessing PHI. But again, none of that has to be done within our July to September 1st timeframe. It's just an FYI for what's coming up. Next page. And as mentioned, so we are planning to have a specific webinar about training. How do I get in the system? What do these buttons mean? Let's walk through what a lead care provider will see. And we can also walk through what an administrative proxy can do or can't do and things like that. We have this scheduled for Wednesday, June 30th. So that is just slightly before that opening of the portal. And obviously that recording will be distributed and can be viewed, anytime. We also would like to be as available as possible during our short enrollment period. So during that, so the July 9th is actually a Friday. So starting that following Monday on July 12th through the end of the enrollment period, we will be having 2 office hours, which will strictly focus on how do I get, if there are any questions with the EEP enrollment or even questions related to the enrollment policy or process, we will make sure that we are available to answer one-on-one questions. And if those times don't work, again, hopefully we've been as transparent as we will make time. So if there are people that want some one-on-ones, once the portal opens and they can actually see the software, we can definitely schedule some one-on-ones with people, but our hope is that at least making, 2 half-an-hour slots every week, people can just come in and ask Q&As or get a one-on-one demo for that. Additionally, as Maddy mentioned, there are a bunch of other resources in conjunction that will be available at the go live of July 9th. There are the 2 user guides that Maddy mentioned, both of which will be available to download within EEP as well as on the HSCRC website. There also are the EEP 101 slides, provider-specific Q&A. All of those will live within the HSCRC website, but within EEP, you can easily click and go straight to the website. So hopefully, again, that one-stop shop that we're either lives in there or it's just a click away to get you guys to some additional resources. So we're looking forward to demoing this in a couple weeks for everyone. We really want to make sure it's getting to the right people. So specifically those lead care providers that have to first go in and initiate the process, and any administrative proxies or those that anticipate them being administrative proxies that will help support physicians and entities as they continue along this process. I think that is it.
So Jessica, if people want to register for the webinar on the 30th, how do they do that?
So we'll send out a link for shortly. I think we have a list of basically everyone who's on this distribution list. Those have reached out before, or any provider that attended the specialty specific webinars, Jean, that you hosted as well. So we will send that out, and it's kind of similar, a Zoom registration link, but we highly, highly recommend forwarding it to anyone. Obviously, we don't know if there are other people that are available, but we're going to try our best to widely distribute it as much as possible. But hopefully you will get that link, I'd say probably Monday or Tuesday of next week.
And if you need help distributing it, we're very happy to help do that. So just let's get it out. The other thing I did want to say is Jessica mentioned MedChi and the HSCRC with CRISP and Jessica's help. We did 3 educational separate videos or meetings. One that was cardiology based, one that was GI based, and one that was ortho/neurosurgery based or surgery codes based. If you have physicians or others who are interested, all those are on the MedChi webpage. I'm not sure if they're on the HSCRC webpage as well. I think they are. You can go to either the MedChi equip section or the HSCRC equip section. I really would strongly urge you, particularly these are for my hospital friends, those videos are really good because it actually goes through the codes and the bundles and the price, and I think they're very helpful for physicians to watch by their specialty to maybe understand the program. So if you have an orthopod or a cardiologist, it's worth them watching their specific one, particularly when Maddy goes through the actual coding near the end of it, 3/4 of the way through the presentation. So those are worth watching.
Thanks, Jean. Yep, and those slides are also available to download. So the cardiology specific codes and then also statewide analysis are in each of those decks, which I think is helpful to get more specific for each provider.
So I think this is everyone's shot to ask questions. We were shooting for a half an hour. It looks like we're close to on target. To give you some extra time back? So speak now or forever hold your peace, right?
Or you can always email them later as they come to you in the night.
All right, well, everybody have a wonderful Juneteenth and a great Father's Day to the fathers out there. Enjoy your weekend and do something fun and irresponsible.
Thanks, Jean. And again, I just want to say thank you to everyone who's been a part of this process. We are so close to go live. It's really exciting. And, just from the HSCRC perspective, a heartfelt thank you to all of you who've been a part of this committee for the last 2 years, working to help us define, refine, and develop EQUIP. And so we look forward to talking with you next month when we'll actually be in the enrollment period. So thank you again, and we'll be talking to all of you hopefully soon. Take care. Bye-bye.